the picture that we have been looking at for a very long time, and I mean it's for somebody like me who is scientific, I'll say it's data that I think is also, because it's done by a company that has an interest in your health. You also have to take it with a pinch of salt, but a lot of the data that they've generated is accurate. It's accurate. Ghana does some wonderful things, Dave. We do some very wonderful things. In 2011, Ghana decided that we're going to reduce the burden of diseases that are caused by things like hypertension, diabetes, stroke. 2011. We're in 2025. In 2019, we launched guidelines on how medical personnel everywhere, from the one in the CHIPS compound to the one in the teaching hospital, how you should manage heart conditions or cardiovascular diseases. That's 2019. We're in 2025. The picture, 60% of all the deaths that we're seeing in the country, 60% are caused by non-communicable diseases. Hypertension, diabetes, stroke, renal diseases, and its other complications.
But when you say the renal, many people will
kidney.
Ask, what is renal? So let's skip
kidney diseases. Yes. That's 60%.
So the things that you said that we decided to do in 2011, 2019, I'll come to it later. Because why haven't we been able to implement it? Or if we have, how come we've not been able to implement it very well? Because looking at the figures that I just shared a while ago, if we had taken them serious, we shouldn't be having the figures we're having now. So I'll come back to it. But if you listen to the chronic diseases that I mentioned, I started by talking about hypertension. And I said 27 to 62. For the age 62, I'm kind of okay. But age 27...
Why are you okay with 62?
Because lifestyle and age, 62 years.
But the life expectancy in Ghana, the life expectancy in Ghana now is less than 60 years. If you are beyond 60 in Ghana, you're
a blessing.
Yes. Our life expectancy, averagely, is about 58 years.
Wow.
And most people, 5 years post-pension, are still working. So the 27 to 62, it doesn't even work for a lot of people. Most people are 63, 64, and they're still doing some form of work. It may not be formal, may be informal, but he or she is still working. So that age band is a productive age band.
In as much as I agree with you, my question is, years ago, did we have 27-year-olds having hypertension?
No.
Yes, that's where my issue is. So that's where my concern is. What has changed? What is making 27-year-olds have or battle hypertension at that age? And I'm not saying that it's okay for a 62-year-old or 63-year-old to be hypertensive. No. But I'm saying at least we'll sit back and say, oh, so on the way in Chinekakra.
Yeah.
But 27 years and battling hypertension, it doesn't make sense to me.
See, the answer is partly in the the adage you gave, wedding Chinekakra. Salt is one of the leading causes. Excessive salt intake, I should add. One of the leading causes of attributable causes when it comes to hypertension. Now, younger people are becoming hypertensive mainly because of lifestyle. When it comes to something like hypertension and diabetes, there are risk factors. Some you can modify. I mean, this is a country where, like you stated in your introduction, if you drive by your streets this morning, everybody is hawking something in a bowl, and you don't even know how it's regulated. High caffeinated drinks. Every billboard is showing a very fanciful drink that has a lot of calories. You understand?
And the restaurants we go to, and the kind of spices, and we advertise so many different spices on our markets. The ingredients we don't even really know much about.
So nobody is paying attention to Well, we in the health profession, we pay attention to what you see. You are what you eat.
Yeah.
Basic.
Yeah.
You are what you eat. But nobody's paying attention to, okay, 27-year-olds are somebody who has probably finished tertiary, okay, has done probably their national service and is either job hunting or has started their first job. How do you start with hypertension?
Doesn't make sense.
Okay, for you it doesn't make sense, but for us, if you look at the lifestyle choices of younger people, you'd understand. It's not like we were any better, but it has gotten worse.
Again, one of the concerns that I have, and I said I'm not going to rush this conversation, even if it would take 3-4 days to run through it.
I'm here for you.
We'll do it.